Application of the iTrace Visual Function Analyzer, Phase 2, Routine Level. For preoperative assessment, we only need to review two reports. The first preoperative report, Report 1, is used to determine whether cataract surgery is needed. The key metric to focus on here is the Lens Dysfunction Index, DLI. DLI, 0 to 10 scoring scale. This is a 0 to 10 rating system, where lower scores indicate worse lens function. Example, in the figure, the DLI is 2.3, which is very low. This indicates poor lens function. Decision flow. If DLI is greater than 5, the lens is still functional. Cataract surgery may not be necessary at this stage. If DLI is less than 5, further evaluation is required. If corneal higher-order aberrations, HOAs, are greater than 0.2, the cornea is compromised. Do not consider premium IOLs, e.g., multifocal/toric IOLs. If corneal HOAs are less than 0.2, the cornea is in good condition. Premium IOLs, e.g., multifocal/toric IOLs, can be considered. Note, the threshold of 5 is a general guideline and should be adjusted based on individual cases. Additionally, this report also allows you to review the opacity topography. Irregular opacity, partial opacity. Central opacity likely indicates a nuclear cataract. Overall opacity likely indicates a cortical cataract. Important, these opacities are also associated with a low DLI, because cataracts not only cause visible clouding but also degrade the optical performance of the lens. Opacity in the absence of obvious clouding, no visible turbidity. A low DLI may still occur even without visible lens opacity. This is because early-stage cataracts may not yet show obvious clouding but can still affect visual quality to varying degrees. Caution for the turbidity map. The turbidity map reflects the entire eye, so the first step is to assess whether the cornea is abnormal. The opacity may not necessarily correspond to the lens. Example, in one case, the turbidity map shows opacity in the temporal region, but this is actually due to pterygium on the cornea, not lens opacity. How to select premium IOLs? Refer to the second preoperative report, Report 2. The second preoperative report focuses on the right side, which displays the key indicators for premium IOL selection. When zoomed in, there are four main parameters: corneal higher-order aberrations, alpha angle, corneal astigmatism, and corneal 6 mm spherical aberration. There are three common types of premium IOLs: aspheric, multifocal, and toric. For multifocal IOLs, the key metric is the alpha angle. For toric IOLs, the key metric is corneal astigmatism. For aspheric IOLs, the key metric is the corneal 6 mm spherical aberration, as shown in the report. Additional preoperative report for toric IOLs, if applicable. For toric IOLs, there is an additional preoperative report. This report includes not only the toric IOL positioning analysis but also serves as a feature-rich simulator. Report layout. Left side, large image external eye imaging. Right side, measured values from the device. Key focus, bottom right corner, postoperative total eye astigmatism. Default settings: the surgical incision is typically set at 135 degrees, with a surgically induced astigmatism, SIA, of 0.5 diopters. These can be modified based on the surgeon's preferences. Adjusting the incision position: use the left mouse button to drag within the blue simulated incision area, hold and move, to adjust the angle freely. Adjusting the toric IOL axis: use the left mouse button to drag within the yellow area, hold and move, to change the axis angle freely. The total eye astigmatism will update in real time as you adjust. Postoperative analysis, focusing on one key report. For postoperative assessment, we primarily review this single report, which focuses on analyzing aberrations, optical errors. First, check if there are any aberrations across the entire eye. If no aberrations are present, visual quality is definitely good. If aberrations are present, determine whether they originate from the cornea or the intraocular structures, e.g., the IOL. Each type of aberration corresponds to specific clinical issues. Postoperative analysis, using the primary report. For postoperative assessment, we typically rely on this one report, analyzing aberrations based on their source and type. Examples of aberration source correlations. Intraocular astigmatism, usually caused by undercorrection/overcorrection of the toric IOL or incorrect axis alignment. Intraocular coma, typically results from IOL decentration or tilt. High corneal astigmatism, often due to short postoperative duration, residual SIA, or the eye not yet fully healed, early stage SIA. Corneal coma, usually caused by decentered laser ablation or keratoconus. Corneal spherical aberration, caused by a small optical zone during surgery. Corneal trefoil, caused by prior RK, radial keratotomy, surgery. Approach: match the observed aberrations in the iTrace report to these clinical correlations to easily identify the problem source. Additional postoperative report for toric IOLs, if applicable. For toric IOLs, there is a second postoperative report. Advantage: no pupil dilation is required. Key visuals. Top left image, blue represents the intraocular astigmatism flat axis. Middle image, red represents the corneal astigmatism steep axis. Principle: the two axes should be as aligned as possible, based on the direction of the astigmatism. Bottom left. Current corneal astigmatism. Current IOL astigmatism. Current total eye astigmatism. Interpretation: if IOL astigmatism is less than corneal astigmatism, the toric IOL is undercorrecting, too weak. If IOL astigmatism is greater than corneal astigmatism, the toric IOL is overcorrecting, too strong. Below, estimated post-adjustment total eye astigmatism. How to adjust: follow the large text prompts at the bottom right. Rotation angle for adjustment and improvement in cylinder power. Top section, current refraction values. Bottom section, estimated refraction values after adjustment. Summary: postoperative aberrations and corresponding clinical issues. Use the reference flowchart. When specific aberrations appear in the iTrace report, you can easily determine the corresponding clinical problems.